Hello, my name is Dr. Uche from Health Rights Medical and Wellness Center, your one-stop medical and wellness center with a lifestyle medicine clinic in addition to the other regular medical clinics. Okay, so we're going to be talking about something that is very important for your health. This is your annual medical screening. We said annual, meaning that it is something you need to do every year. Okay, so it doesn't matter the month, whether it is done in December, it is done early in the year in January, or whether it is done in August or September. The important thing is that you should schedule to have one every year. It's really good for your health to know your numbers and to know what is up with your health, what is happening inside of you that you cannot see. Why do you need to do this annual medical screening? You actually need to do this because many diseases, many chronic diseases that you know are usually silent. You will not have any indication at all that something is wrong with you. Some of it, the first indication that anybody gets that something is wrong with you is death. These diseases, I will mention some of the very common ones. Hypertension. We already know that we call it the silent killer because so many people will not have any indication at all that something is wrong with them. No signs, no symptoms. Another one is diabetes. Now, most times, at the early stages, nothing. People don't know that anything is wrong with them, especially at the pre-diabetes stage. So at that stage that is called pre-diabetes, most people don't even know anything is going wrong at all. And these diseases like diabetes and hypertension can damage your kidneys. Both of them can cause kidney failure. Hypertension can cause a stroke. Diabetes can cause you to get foot ulcers. It can cause nerve damage. It can even lead to blindness. This is one reason why you need to know early and be able to revert if something is about to go wrong. Like if you're in pre-diabetes, you can quickly reverse it with lifestyle. Okay, so this is the reason for the annual medical screening, because people are walking around without knowing that something bad is happening inside of them. What are these things that we check in your annual medical screening? They are not only blood tests. The very first one is your blood pressure. This is important. Remember we talked about hypertension, high blood pressure. So this is one test that anybody who walks into any clinic gets. No matter what is wrong with you, once you enter any clinic, you will get your blood pressure checked because it's part of the vital signs. When we check vital signs when you come to the clinic, we'll check your pulse, we'll check your blood pressure, we'll check your temperature, we'll check your SpO2. So you will get your blood pressure checked. This is an important thing that you need to know. That blood pressure number is an important number that you have to have at the tip of your fingers. Why? So that you can avoid sudden death. Okay. Now, another one is your weight. Yes, it's a no-brainer, but your weight is very important. Okay. When we check the weight, we also check the BMI. But the BMI is not the most important thing. The most important thing as a lifestyle medicine physician is that we check your waist circumference and we check your waist to hip ratio. That number is actually something that is more important to us than just your BMI. So this is something that you can get checked out in a clinic. The next test that you should do is your blood sugar test. Okay, so people normally get a fasting blood sugar or a random blood sugar. This is just a one point in time test. Okay, so for me as a lifestyle medicine physician, what I recommend is your hemoglobin A1 A1C test. Okay, if you cannot do the hemoglobin A1C test, I like to get your OGTT, oral glucose tolerance test, because it doesn't make sense to diagnose diabetes with just a one-time test. We normally have to do that test more than once, but the OGTT and the HbA1c test, they are the gold standard for diagnosing diabetes. Okay, now why do I prefer a hemoglobin A1c test? I prefer that because when you do the hemoglobin A1c test, it's actually telling us how much sugar your blood has been carrying for the past 2 to 3 months. So we get an idea of not just what happened the day before, what you ate the day before, or what has been happening with you the day before. Okay, so that is one test that I prefer. We call it HbA1c, hemoglobin A1c test. Now, another test that is very important is the one we should actually do first anytime you walk into the hospital. The urinalysis is really a very simple test. It's a bedside test. So that's one thing that we can do immediately you walk into any hospital. The urinalysis will tell us a lot, right? We can even see sugar in the urine, or we can see protein in the urine. So when we see these things, that point us to diseases. The next one is your full blood count. This is one test that shows us your blood picture. We'll see your red blood cells to know whether you have anemia or not. We see your white blood cells to know whether you're struggling with infections or not, because we know if the white blood cells are either too high or too low, it tells us something. We also have the differentials, so the different white blood cells also tells us another story. We see your platelets. In fact, the full blood count is one of the major tests that you do in a hospital. If it's in a climb where that everybody has money, the full blood count should be a regular test that you must do each time you go for a checkup, right? So it's very, very important because it gives us a picture of what is happening in your blood, and it's very helpful. It's so good that you can even find out that, oh, this blood picture is pointing to a chronic infection or a chronic disease. This number is so high. Why don't we even check? Does this person have a cancer or something? And there's something that is attached to the full blood count, which we call the erythrocyte sedimentation rate. You can just know it as ESR. The ESR gives us a huge indication of when something is wrong with you. So it's a test that you should note when you go to check up. Another important test is your kidney function test, because this one tells us how your kidneys are doing. Everybody needs to do this test because you don't want your kidneys to fail. You want to know what is happening with your kidneys. Why? Because it won't give you any signs or symptoms until up to 90% of kidney function is lost. So you need to know early because it won't give you those signs that you're looking for, right? So it's important for us to have a kidney function test because nobody wants to do dialysis. If your kidney fails, you will need dialysis to survive. And nobody wants that because it's so expensive. Now, another test is your liver function test. This liver function test is very, very important. A lot of people are walking around today with fatty liver disease. We call it hepatic steatosis. But they don't know. If you do your liver function test, and we see what is happening with the liver, the liver enzymes and all that, it can give a little indication when something is wrong with your liver. Another test is the one everybody knows. They call it the cholesterol test, but I prefer to call it your lipid profile test. So when we say your lipid profile test, we are looking at your total cholesterol. We are looking at the low density lipoprotein, that's the LDL, that's the bad cholesterol. We are looking at the high density lipoprotein, HDL, that is the good cholesterol. Okay, and we're looking at the triglycerides. These numbers are important because cholesterol clogs arteries. Remember I said that there's a good cholesterol. So we want the good cholesterol to be high enough. The good cholesterol helps to, ameliorate the bad. So we need more of the good and less of the bad. This cholesterol that clogs arteries leads to atherosclerosis, and it can lead to blocked arteries. Nobody wants to have all those kind of diseases that come from blocked arteries. Now, there are two tests that are also recommended for your annual medical screening. So it's either the pap smear if you are a woman from 21 years to 65 years, or the PSA if you are a man above 45 years. These days, I'm asking men above 40 to do this test because we are seeing people having prostate cancer very early. So if you have a family history of prostate cancer, you should have this test done earlier than 45. I encourage many men to start doing this test earlier, okay, so that they can even watch the trajectory and see how that PSA number is increasing. Now, women need to get their pap smear done. Why? The reason is that the pap smear can actually catch not just cervical cancer, it can catch cervical cancer. If you do it regularly, you'll be able to catch cervical cancer in the early stages. We have the one we call precancerous lesions. So if you catch it at that point, it is totally treatable. Totally treatable. And when you have an indication that you have cervical cancer early, the treatment is, better, and it's of more benefit to you than when you are in the late stages. Maybe it has even spread. You are now dealing with full-blown cancer. That's why early detection is so important. It's important for people, both men and women, to do these tests and detect any diseases that could come up early. Of course, there are other tests in the annual medical screening that people can go to town with. They can do thyroid function tests, you can do ECG, you can do your mammogram for women, you can do even ultrasound, so many other things. But I've said the basic ones, and these basic ones are really non-negotiable. I encourage everyone to get them done. And yes, we have a promotion. We always have a promotion at Health Rights Medical and Wellness Center. You can get this test done. We can even go the extra mile for people who are around the Lekki area. We can actually even come to you to pick up your samples. Now, what are you waiting for? What is your excuse? Do the right thing for your health. Prioritize yourself. As you're doing your own, also check for your loved ones. Make sure you encourage them to get this done.